So there was a sigh of relief as the national state of disaster was lifted, but Cooperative Governance Minister Nkosazana Dlamini Zuma says that doesn't mean it won't come back. She warns government can declare disaster again if COVID-19 infections escalate. Let's speak to public health expert Alex van der Heever about this very matter. Good morning, Professor, and thank you very much for your time. You know, many seemed actually to welcome the lifting of the national state of disaster, given its economic impact, among others. But listening to the minister yesterday, it seems there would be an appetite to bring it back should cases surge. Honestly, should the state of disaster be that go-to intervention when numbers increase, given the limitation of rights that it comes with? I mean, even the new regulatory regime might be challenged in court, as we're hearing from many organizations.
Yeah, so you can't really go on case numbers for reinstating the state of disaster. It really depends on whether or not we're seeing significant severe illness. So it's highly probable that we will see quite high case numbers in a fifth wave, because the virus is now endemic. So we can't basically reintroduce a state of disaster every sort of 3 months. That doesn't make sense. So the real question is whether or not we're facing a real public health emergency that only a state of disaster can address. At this point in time, the best interventions are vaccination, additional boosting, and making sure that all vulnerable people are vaccinated as far as possible. And to the extent that people are not coming forward, the focus of government really has to be on making sure that its messaging is really getting through, which they're not doing very well at this point. So one really has to get that done.
So what are we missing here, or what is government missing? Because they have essentially confined themselves to the numbers, that should they increase, this is what will happen. So
the numbers are going to increase. Yeah, I mean, that would be problematic. The numbers are going to definitely increase. But as we saw with the Omicron variant, severe illness and the impact on the sort of inpatient services was muted in comparison to the previous waves. And that's likely to be the case going forward. So what we're seeing is that a degree of immunity wanes after a few months, and a new variant invariably is associated with every new wave. It's just the virus is going to mutate, like the flu virus does every few months. That the question is whether it mutates sufficiently to evade the immune defenses. So it does evade the defenses that result in infection, but it doesn't necessarily evade the defenses that result in severe illness. So that really is the only key test. It's quite likely that testing itself is going to diminish over the next few months as well, and that we're not actually even going to see the number of cases or the number of infected people. It's really going to be the hospital settings where we will see cases, and we will have to evaluate whether or not we're dealing with a real disaster that only a state of disaster reinstatement can address.
Then it's clearly quite myopic to be threatening to bring it back. But then if we speak of the fifth wave, I mean, we keep hearing of a looming fifth wave, and the debate now has started around whether it was wise to lift that state of disaster, while most of us would think that the reality is you cannot declare or maintain a state of disaster in anticipation of a disaster. You, in fact, have to be in the disaster. So what does it mean for government now? Because clearly they don't want to fold their arms. So what do they do in anticipation for that fifth wave?
I think the messaging is poor. I think that a lot of people do understand the nature now of the pandemic, of the residual effects of this pandemic. We can't be in a state of disaster indefinitely for the rest of our lives. And we're going to be with this virus for the rest of our lives. It's not going to go away. So the issue is really how we're going to manage it going forward. We're managing now a continuous state of infection, as we do with flus. Flus also result in a degree of mortality, and you can prevent some of that through vaccination. We will also have a growing immunity from infection as well, from people who only develop mild disease. And we've had a substantial number of infections in South Africa. So it's not only the vaccinations that matter. A lot of people have actually been infected, not once, but multiple times. So we've got a degree of immunity that's built up. So we really do have to look at whether or not we're facing a serious situation. Countries that still have a large population susceptible to severe illness, not to infection, but to severe illness, are going to be at risk going forward. And I think that it's the evidence thus far and from the last wave was that we've seen this decoupling of infections and severe illness. And it's very probable that that will continue. And unless that changes, I don't think we should be considering using the state of disaster to manage this pandemic anymore.
Then we move away from the state of disaster and to the current regulatory regime. It seems some aren't happy even. They believe government lifted that state of disaster to somewhat stave off litigation. But would that really be the case in this instance? Because some are saying that they haven't exactly relinquished regulatory power. It's somehow disguised.
Well, the transitional measures that have been implemented, I mean, there's some questions that have been raised over whether or not the enabling legislation allows for these particular transitional measures. So there might even be litigation on the transitional measures. But it's uncertain, really. So there's some provisions that are actually important to continue with. The contractual arrangements around the vaccines do require that there is some arrangement that allows for the evaluation of any side effects on vaccines and for compensation. So that's one particular element, but that doesn't really require, it's not the state of disaster that's basically dealing with the historical impact of the state of disaster, dealing with the actual mitigation measures we've introduced, the vaccines. The other measure was the social relief of distress grant, which does need to have a transitional arrangement in place because we have to have new regulations in terms of the Social Assistance Act, and you absolutely cannot withdraw that grant. So I think that that's actually very key. So no matter what happens, that does need to be insulated. But those two provisions don't really deal with restrictions on people's movement in society as such. They are much more about the sort of the after effects of the overall pandemic. And we now need to just normalize those interventions in terms of other legislation and give some space for that to be done.
But it seems that is the contentious part, the normalizing of some of these regulations. Beyond those two, whether it's the wearing of masks, it seems that some are even looking to defy, or there would be organizations that are actually addressing communities to say, perhaps you don't need to comply, because this is them normalizing lockdown in ordinary day living beyond the state of disaster.
Yeah, so I think that there's been a loss of trust in government messaging around the pandemic, which is unfortunate, because in some cases it will probably be important for people to protect themselves and vulnerable individuals with mask wearing in indoor settings. And that might need to continue because some people are going to develop chronic conditions down the line that will make them vulnerable to infection as their immunity wanes. So you have to be wary going forward. But it's the same issue with flus and other equivalent types of infections. So what you want to do is to say, well, the question is, does it require a mask mandate? And I think that we're moving toward a situation where it's going to be much more the individual discretion and their own individual assessment of risk as to what they do in certain situations rather than a mandate. But I think that at this point it would have been preferable if people were able to trust the messaging of government to say, you know, in these settings, we think it's still in your interest to do A, B, C, and D, and not to have people say, we're just going to defy you. I think then we've lost kind of control over dealing with future pandemics as well. I think that's a very bad thing to happen. And I do think government needs to consider how it's managed that type of issue in society. They have really kind of lost communities in their communication strategies.
No, very concerning, but most certainly very interesting to watch what will happen if some of these or this regulatory framework is in fact challenged in court. It would be interesting to hear what the judges make of this. Thank you very much, Professor. That was public health expert Alex van Heever.